some of my relatives suffer from these cardiometabolic diseases such as diabetes, hypertension. So when I was coming here, I wanted to learn these conditions so that I can be able even to help them back at home, and also try in preventing the conditions from being more rampant all around the villages and also in the people in the community.
This is exactly why the Novo Nordisk Foundation and our partners are working together on the Partnership for Education of Health Professionals, also called PEP, to ensure that health professionals are equipped to provide quality prevention and care for cardiometabolic diseases, including for people in vulnerable positions.
Cardiometabolic diseases are a huge burden in the continent today. Just cardiovascular diseases are the top killer globally. And 75% of deaths that we see from cardiovascular diseases actually happening in low and middle income countries. But unfortunately, we are not seeing commensurate investments.
And I know you're going to learn about hypertension, monitoring our blood pressure every day.
I think the PEP program, is going to be transformative, because in the end that also accompanies the shift in the policy, the shift in allocation of resources, the shift in the essential medicine list for different levels of care. I think this is something which is going to be a game changer for many reasons.
In the first year of PEP in Kenya, 6 partners and the Ministry of Health in Kenya collaborated to develop and rolled out tools to assess training needs and curriculum gaps across medical training colleges in Kenya. This has laid the foundation for PEP to strengthen the capacity of education institutions to provide competency-based education and clinical training, including through online and blended learning.
One of the things that PEP is actually focused on doing is ensuring we have a pre-service curriculum such that we end up graduating fit-for-purpose healthcare providers who are ready to diagnose and manage cardiometabolic diseases, as well as aware of what the risk factors are, and therefore they can advise community members on how to prevent or else delay the onset of these conditions.
When we build the capacity of training institutions, which we are doing through PEP, and those training institutions are able to equip learners with the necessary competencies and skills to address cardiometabolic diseases, we then expect that the services that those learners will provide when they get employed will lead to improved health outcomes, which means then reduced mortality and morbidity that's coming from cardiometabolic disease. That's huge.
And in the long term, I believe this program can actually enhance and give the place of CMDs where it deserves in the training, so that when we are able to release the trainees after their training, they can be better able to handle the diseases when they meet them later.